I would like to acknowledge the traditional owners of the land we are meeting on and acknowledge the elders, past and present and emerging, as well as any Aboriginal or Torres Strait Islander people attending today. Welcome to clinical placement at Blacktown Mount Druitt Hospital. Blacktown Mount Druitt Hospital is one of 4 hospitals located within Western Sydney Local Health District. Blacktown Mount Druitt Hospital is a single hospital operating over 2 campuses, one at Blacktown and the other at Mount Druitt. Blacktown Mount Druitt Hospital is a 570 acute care hospital. Blacktown Hospital is a teaching hospital of the Western Sydney University Medical School. Blacktown is the second largest local government area in Australia with a population of 350,000 people and has the second largest Aboriginal and Torres Strait Islander population after the Central Coast. On your placement, it is important to be aware of all emergency and evacuation procedures. The emergency number is 2222. Whilst on placement, your student photo identification badge supplied by your education provider must be worn and visible at all times at chest level. Education provider uniform must be worn whilst on clinical placement. Long-sleeve t-shirts or undergarments must not be worn under your uniform. Policy is bare to the elbow. No jewellery is allowed. Earrings have to be a small stud or small sleeper only, and only a wedding ring is allowed. Nail polish and artificial nails are not permitted. We practice at all times the 5 moments of hand hygiene. Please be aware that this is one of the most important ways to control infection spread. The use of mobile phones is not permitted at any time when delivering patient care or any activity associated with interactions between patients, relatives or carers. You cannot use your mobile phone at any time while in the clinical area. Students are not permitted to take photographs or enter any details or make any comments on any social networking site that displays or makes reference to any patient or person or identity that could be identified as being related to any patient or work-related activities. Western Sydney Local Health District and New South Wales Health have an absolute no smoking policy. Placements will be cancelled if this policy is not adhered to. Shift information will be given to you on the first day of placement. Shifts cannot be swapped with other students. You must sign on in the ward daily allocation book, and you can check this with your NUM or MUM or team leader. Whilst on placement, you will be under the direct supervision of a registered nurse. This can include casual or agency registered nurses. If you have any concerns or problems during your placement, please contact your facilitator and your NUM or MUM in the first instance. Please notify your facilitator and the MUM, NUM or nursing team leader immediately of any accident, incident or any near misses that occur whilst on placement. Your facilitator will notify your education provider. An IMS form must be completed by the student and the ward staff. All students must complete the New South Wales Health Mandatory Education modules in My Health Learning, including e-learning courses as required. You will be given access to electronic medical records using your StaffLink number and password. You do not share your login with anyone, and you do not use your access to search records of yourself or people you know. All entries in the electronic medical records must be checked and signed off by your assigned registered nurse. Students are on clinical placement to achieve mandatory clinical hours. Students may attend ward in-service with their registered nurse, but you do not attend hospital in-services unless permission is granted by the facility coordinator. Food is available from several outlets in Hospital Street near the main entrance. We do not have a staff cafeteria. ATMs are available in the Hospital Street, and we provide a masala prayer room and lactation facilities are available. All facilities are accessible via public transport, but there is limited public car parking which is available, but at your own cost. If you park a long way from the hospital, you are encouraged to move your car closer in daylight hours. We hope that you find your placement to be a valuable and worthwhile experience. If you have any questions or concerns whilst on placement, please refer at any time to your facilitator, your nursing unit manager, or your assigned registered nurse. Thank you.